Welcome to the second installment of our Q&A face covering video series, where we invite experts to come and address questions you may have about face coverings and prevented COVID-19 on the farm. Our guest today is Dr. Fred Gerr, a physician who specializes in internal medicine and occupational medicine. Dr. Gerr is a member of the faculty in both the College of Public Health and the Carver College of Medicine at the University of Iowa. Why do we need to wear cloth face coverings right now?
Cloth face coverings are one of our most important tools for preventing the spread of COVID-19. And cloth face coverings prevent the spread of COVID-19 by acting in two separate ways. First, when a person who has COVID-19 but doesn't know it, and that happens with some frequency, when that person wears a cloth face covering, it reduces the chances that that person will spread the virus to others when they talk, cough, or sneeze. Because this virus typically spreads by leaving our mouths when we're talking, coughing, or sneezing, and being spread through the air to a person who's not infected, who breathes the virus in with air and then becomes infected. The cloth face covering blocks that virus from leaving that person's mouth and nose and becoming airborne. In addition to that, the cloth face covering may also reduce the amount of virus that the wearer inhales that's been spread into the air by infected persons. So the cloth face covering acts in two ways to prevent the spread of COVID, and as I mentioned, is one of our most important tools for keeping people healthy.
So are there any instances where if someone's not in perfect health, this could actually be an issue?
A few, but the news here is almost entirely good. The vast majority of adults who are healthy enough to be employed in almost any capacity are also able to wear a cloth face covering without having any interference or any difficulty with any long-term medical conditions that they may have. And plenty of us, I might add, have medical conditions. High blood pressure is common, high cholesterol. Many people in agriculture have asthma. And people with each of these conditions and many others can wear cloth face coverings without any difficulty at all. We know from the many millions of people who have been wearing face coverings for many decades that they can wear face coverings safely and without difficulty, even while having some long-term medical problems. There are some people who ought to talk to their doctor prior to wearing the cloth face covering. And those are people who have either severe heart illnesses or severe lung disease. And when I say severe, I mean illness that is sufficiently advanced or problematic that it causes them difficulty going about their ordinary activities of daily life. In fact, most people with mild or moderate heart illness or mild or moderate lung disease can wear a cloth face covering without any additional risk to their health.
Especially on social media, there seems to be a lot of things kind of flying around and being shared, claiming that these coverings or any kind of mask is going to affect how much oxygen you're able to take in. They're saying, the carbon dioxide will build up in the mask and I won't have enough oxygen and that will hurt me. Is that true? Can you address kind of what that claim?
I can address those claims. The short answer is that those claims are completely false. And let me just take a minute and explain. Of course, everyone knows that we breathe air in so that our bodies can extract some oxygen from that air, which we need in order to sustain our metabolism and all of our tissues. A byproduct of our metabolism is that our bodies produce carbon dioxide, which we then exhale into the air. The cloth face covering has no effect on how much oxygen you breathe in, whether you breathe it in through the cloth of the mask, or you breathe it in while wearing no mask at all. In addition, the cloth face covering has no impact on our ability to rid our bodies of the waste gas, carbon dioxide. Carbon dioxide as well passes freely through the cloth of the face mask. So I know, and I've even seen on the internet, people taking probes and putting them in the mask and showing decreases in oxygen or increases in carbon dioxide. But in fact, either they're not using the probe correctly or they're just misleading people in how they're going about this demonstration. It's very well established. The mask in no way deprives the wearer of oxygen or makes undesirable carbon dioxide build up in their bodies.
Another question we've got is, does wearing one of these increase someone's chances of heat illness, or, is this going to make them overheat?
The quick answer is no, it will not. The cloth face covering covers just a tiny fraction of the body, and it does not increase any worker's chance of heat illness. So given that it's summertime, the important steps, or the steps that are important to protect oneself or one's employees from heat illness, are unchanged. Take the exact same steps to prevent heat illness that would be taken whether the worker has a cloth face covering or not. The cloth face covering should be removed only when drinking water. And of course, good hydration with water is one of the important ways to stay healthy while working in hot weather.
Do you have any advice on the best way to remove that covering then when you go to take a drink?
The cloth face mask should be handled by the straps. Because it's always possible that our hands start to become contaminated with COVID virus, we'd rather that nobody get their hands on either the outside and especially not on the inside of the face covering. The best way to prevent that from happening and the most hygienic way to handle the mask is by the straps and only by the straps.
This is a new thing to do for most people, at least in some situations where they're not used to wearing it. And I think people kind of recognize that things feel a little different when they're wearing it. And so some of the questions we've seen is, I know this feels different, or I feel uncomfortable when I'm wearing this covering. Is this a problem?
Some people do feel uncomfortable wearing a face covering. Some people get used to that too over time. It's important to recognize that the discomfort that a person experiences while wearing a cloth face covering is not an indication of an injury or harm to the wearer. It's just a discomfort, but not a hazard. Nevertheless, for reasons of either claustrophobia, which many people experience when they have something covering their face, or because it's unusual for people to experience the sensation of moving air through any kind of barrier, cloth face covering being that kind of barrier. Some people feel like they're not breathing properly or they're not breathing fully. That is just a sensation. It's not a reality that those people aren't getting enough air. Still, we know from other settings where people wear face coverings that these experiences can be just plain intolerable to a very small portion of people who experience them. Under those circumstances, if a person feels that they must remove the mask, all they need to do is to take a few steps, or maybe more than a few steps, but move away from other people, 20 feet, something like that. Then they can remove the mask, and that way any air that they exhale won't be a hazard for anyone else. And if anyone else is ill with the virus and they're exhaling it, the person who just took the mask off will be far enough away that it won't be a big problem.
I really appreciate you taking the time to talk with us today. And those were certainly some of the most common questions that we've seen right now. That being said, do you have any final thoughts on this topic? Anything you'd like to share as a closing remark for our viewers?
Just to reiterate on a couple of the points that we've made, face coverings are widely acknowledged in the United States and, in fact, around the world to be a very effective way of preventing the spread of the virus that causes COVID-19. And that's why we advocate that people put up with the nuisance of wearing them, because the nuisance is minor and the benefits are really substantial. The good news is that, as we've talked about, cloth face coverings, although at times uncomfortable or inconvenient, are very, very safe. People with pre-existing illnesses can use them almost always without any difficulty. Cloth face coverings also won't cause new illnesses for people who don't experience them currently. So, all in all, the benefits are substantial and the problems, in perspective, are minor.
Just a reminder, this was the second video in our three-part series. Our first video covered the importance of wearing a face covering and when they should be used on the farm. In our next video, we will go over some different features of face coverings to help you choose the one that will work best for you. If you have any questions about preventing COVID-19 on the farm, please contact us and check out our website for additional resources.